Hello guys, welcome back to my page again in my health hub. So on this video I'll be answering some of the questions, the gynecological questions that some women find too embarrassed to ask. Okay, so I have my friend here, Tonia, that will be asking me the question on behalf of the patient, and I'll be answering the question. You may also try to answer the question if you know them. Okay, Tonia, are you ready?
Yes.
All right then, let's start. Okay, is it actually normal to have discharge every single day, or is that an infection? Yes, it is absolutely normal. The vagina is self-cleansing, and you can actually have vaginal discharge throughout your cycle almost every day, and this discharge changes throughout the cycle. It can be clear, white, creamy, and yeah, just like that. But whenever you notice any greenish discharge, any smelly discharge, it shouldn't smell. Any strong smelly discharge, or it starts itching and makes you uncomfortable, then you need to go get checked. But aside from that, you can have vaginal discharge throughout your cycle. It changes. Why is my period perfectly regular 1 month and suddenly becomes irregular the other month? Yes, actually, it happens, and this is because of many factors that affect the period. It can be stress, it can be illness, it can be hormonal changes, it can be lack of sleep, it can even be travel or change of environment. So all this can affect your period. It happened to me, so I am talking from experience. It can affect your cycle. However, when this your period becomes frequently irregular, and then you did not see your period for like months, maybe from 2 to 3, in fact from 2 to 3 months, you should be worried. Then you need to go speak to your healthcare provider. You don't need to waste time. You don't need to start waiting or start getting any advice from anywhere. You need to go see your doctor. How do women know the difference between BV, I mean bacterial vaginosis, thrush, and STI? Yeah, this is why it's not good to self-diagnose yourself or start guessing. It is not right to guess. Now, the thrush can have thick discharge and itching. The bacterial vaginosis on its own can have a thin, fishy, smelly discharge. But then the sexually transmitted infection might just have irregular discharge that can be any color. It can be pain, itching. It can also be you can also bleed, and then other symptoms. And sometimes you might not even feel any symptoms. You get, so you don't have to self-diagnose. When you start feeling something unusual with your body, you need to go to the doctor and get tested. It is better for the doctor or your gynecologist to say that we've tested and everything is fine, rather than you saying, oh, it's just BV and there's nothing to do about it, it will go. Or maybe it's just thrush, it will still go. Okay. You need to get tested and be sure of whatever you're testing. And finally, why do women feel pain during sweating activities but they don't talk about it? If you've been following me before now, you will know what sweating activity means. So women tend not to talk about this because they feel it's normal. It is never normal. Whenever you're having pain in your body, it's not normal. It's your body trying to tell you something, so you don't have to ignore or tolerate it. Okay, so it can be as a result of anxiety or even vaginal dryness, or probably you have a pelvic conditions like endometriosis and or other medical problems. So you don't have to ignore it. Whenever you're having pain during sweating activities, you should definitely, please, go to your gynecologist. Anyhow you want to explain it to them, anyhow you want to say, just try and communicate. Tell them so they will examine you and see what is happening and know why it is happening. Okay? So guys, make sure you report any concerns you have with your body. If there's any other thing you want me to talk about, any gynecological issues you want me to talk about, you can send me a DM and then we'll bring it up here again. Nobody knows you're the one that asked the question, so we'll bring it up here and discuss it. If you also like this section, let me know so we know if we're going to continue or not. We're just trying a different pattern of communicating these health issues and problems. Okay, see you guys in my next video. Bye bye.